Hello and welcome to today's session. Today's session we are looking at IMNCI, and this initial stands for Integrated Management of Neonatal and Childhood Illness. Guys, before this strategy came in place, the world has been witnessing high mortalities among children and infants, especially in third world countries. And that's why WHO, World Health Organization, and UNICEF, United Children's Funds, they came up with this approach so as to solve the problem. Therefore, IMNCI is a comprehensive approach developed by WHO and UNICEF to improve the health and survival of infants, young children in low resource settings. It aims to reduce mortality by addressing the leading causes of death in children under 5 years old, which are normally preventable or treatable with simple interventions. So INCI has several components, and these components include early identification and management, where we are saying that IMCI emphasizes early recognition of common childhood illness and danger signs both in neonates, and neonates are infants aged 0 to 28 days, and children. Children, this one are aged 2 months to 5 years. So this is done by detecting illness early. Appropriate treatment can be provided promptly, preventing complication and reducing the risk of death. The second component is holistic assessment, and INCI ensures healthcare providers are trained to use holistic approach to assess holistic health and the well-being of a child. This involves considering the child's nutrition, growth, vaccination status, development, in addition to identifying the specific illness. The third component is standardized guidelines. So it's saying that INCI provides standardized guidelines and protocols for the diagnosis, treatment, and follow-up of common childhood illness. So these guidelines are usually evidence-based and designed to be easy to follow, even in resource-limited settings where mortality has been reported so high. The fourth component is health system strengthening, and they're saying that INCI implementation involves training healthcare providers at community and health facility levels to recognize and manage childhood illness effectively. It also includes supportive supervision, continuous improvement to ensure adherence to best practices. The fifth component is community involvement, where INCI encourages community participation and health education to promote preventive measures such as breastfeeding, proper nutrition, vaccination. Community health workers, play a critical role in identifying and referring sick children to health facilities. The last one is to focus on neonatal health, so that INCI places significant emphasis on neonatal health as the first month of life that is critical period for the survival of the newborn. It aims to identify and manage sick children, addressing conditions like sepsis, birth asphyxia, and low birth weight. So by integrating all these components of INCI, this strategy provides a better strategy to tackle childhood illness, reduce child mortality, improve overall health and well-being of children in resource-constrained areas. It has been widely adopted and implemented in various countries, showing promising results in saving lives and strengthening health system in those different countries. Remember, we are going to share some of the best performing nations so that we can be able to compare ourselves and see the success stories. Importance of IMCI in reducing child mortality and improving child health. We are saying we have 7 importance, and these 7 importance include: number one, we have timely identification and management of illness. IMCI focuses on early recognition of common childhood illness and danger signs. So by identifying and treating this illness promptly, complications can be minimized, children's lives can be saved. Many of the leading causes of child mortality, such as pneumonia, diarrhea, malaria, can be effectively managed if detected early, as you all know. The next is holistic approach to child health. IMCI adopts a holistic approach to child health, taking into account various aspects such as nutrition, growth, and development. By considering the child overall well-being, healthcare providers can now address multiple health issues simultaneously and improve the child's overall health outcomes. Next is community involvement and health education. So INCI encourages community participation and involvement of trained community health workers. Through health education and awareness campaign, caregivers and families are empowered with knowledge about preventive measures, proper nutrition, essential health practices. This leads to increased health-seeking behavior and better adherence to treatment plans. Number 4 is standardized guidelines and training. IMCI provides standardized guidelines and protocols for healthcare providers at community and healthcare facility levels. So this evidence-based guidelines ensures consistent and effective management of child illness. So additionally, the training of healthcare workers in INCA protocols enhances their skills in recognizing, managing illness, leading to improved quality of life. Next, we have focus on neonatal health. The first month of life is a critical period of a newborn survival. So INCI emphasizes on neonatal health. So this helps in early identification and management of conditions such as sepsis, birth asphyxia, and low birth weight. Improved care during the neonatal period significantly reduces the neonatal mortality. On health system strengthening, we're saying that ICI implementation involves strengthening of the healthcare systems at various levels. This includes training the healthcare workers, improving infrastructure, ensuring that availability of essential medication and supplies. As a result, healthcare facilities become better equipped to handle childhood illness effectively. On cost-effective intervention, INCI interventions are cost-effective and sustainable. So this makes them feasible for implementation in resource-constrained settings. The program focuses on practical and affordable solutions that can be integrated into existing health systems. Monitoring and evaluation. INCI emphasizes continuous monitoring and evaluation of its implementation. So, regular assessment of program outcomes helps identify areas for improvement and allows for evidence-based adjustments to maximize its impact on child health. In summary, we can say that INCI is vital in reducing child mortality and improving child health because it provides a comprehensive and evidence-based approach to manage childhood illness effectively. By focusing on early detection, community involvement, standardized guidelines, and neonatal health, INCI has potential to save countless lives and contribute to better health outcomes for children in low resource settings. Okay, guys? So we can move from importance and go now to the key components of INCI. And you're saying that the first component is reducing child mortality. One of the central goals of INCI is to reduce the number of deaths among children under 5 years, especially the neonates and young children. So by addressing common childhood illness promptly and effectively, INCI seeks to prevent complications and saves life. Number two is early recognition and management. INCI aims to promote early recognition of childhood illness and danger signs. Timely identification enables healthcare providers to initiate appropriate treatment promptly, reducing the severity of illness and improving the health outcomes. On holistic child health, IMCI takes a comprehensive approach to child health encompassing not only the management of specific illness, but also addressing other important factors such as nutrition, growth, development, and vaccination. By considering the child's overall well-being, IMCI contributes to improved health and development outcomes. On strengthening health systems, IMCI seeks to strengthen health systems at both community and health facility levels, all the 6 levels of healthcare delivery system. This involves training the healthcare providers in IMCI protocols, ensuring the availability of essential medicines and supplies, and improving the overall quality of care provided to these children. We have community involvement and health education. So another critical goal of INCI is to involve the communities actively in promoting child health. This is achieved through training of community healthcare workers and dissemination of health education materials that empower caregivers and families to adopt preventive measures and seek timely health care. Focusing on neonatal health, IMCI places a significant emphasis on improving neonatal health as the first month of life in a period of high vulnerability by addressing newborn health issues like sepsis that you mentioned, birth asphyxia, low birth weight. So IMCI aims to reduce neonatal mortality. On equitable access to health care, IMCI aims to ensure that all children, regardless of their socio-economic status or geographical location, have equitable access to essential healthcare services. These goals aligns with broader principles of health equity and universal health coverage. On integration of existing health programs, IMCI is designed to be integrated with other existing health programs and initiatives. By harmonizing efforts and leveraging resources, IMCI can maximize its impact on child health and contribute to the overall strengthening of healthcare system. Lastly, on continuous improvement and research, IMCI emphasized the importance of continuous monitoring, evaluation, and research to improve program implementation and effectiveness. So, regular assessments helps identify challenges and opportunities for improvement, ensuring the IMCI remains evidence-based and responsive to the changing needs. So by pursuing these key goals, IMCI aims to save lives, enhances child health outcomes, and contribute to the achievement of global targets related to child survival and development. Okay? What about the statistics on global neonatal and childhood mortalities? Well, we have a number of them. Number one, you have neonatal mortality, and this one refers to the number of deaths that occur during the first 28 days of life, and it's compared against 1,000 live births. So globally, the neonatal mortality rate was approximately 18 deaths per 1,000 in 2019. This means that roughly we have a 1.9% of newborns dying within the first month of life. On under 5 mortality, these statistics represent the number of deaths that occur in children under the age of 5 per 1,000. When you look at 2019 statistics, the global under 5 mortality rate was about 39 per 1,000, and this translates to around 3.9%. What about the leading causes of neonatal and childhood deaths? The leading causes of neonatal mortality include preterm birth complications, birth asphyxias, infections, and congenital anomalies. For children aged 1 month to 5 years, the main causes of mortality are pneumonia, diarrhea, malaria, malnutrition, and injuries. What about the statistics on regional disparities? We're saying that neonatal and childhood mortality rates are generally higher in low-income countries. So Sub-Saharan Africa and South Asia have historically had the highest neonatal and under 5 mortality. And this is generally due to limited access to better healthcare. Okay, so management is poor. And thanks to the INCI that tries to come up with easily implementable intervention that can be able to counter the leading causes of mortality. So what is the importance of early detection and prompt management? When we have early detection and prompt management, we have prevention of progression of the illness as the disease is halted before it can complicate. Okay? So many childhood illness, if left untreated, can rapidly progress and become severe, leading to life-threatening complications. So early detection allows healthcare providers to intervene before the illness worsens, reducing the risk for severe outcomes. On reducing mortality, we are saying that early detection and prompt management significantly reduces the risk of mortality in children. So by initiating appropriate treatment early on, INCI aims to prevent deaths caused by common childhood illness such as the pneumonias, the diarrhea, and malaria. Also, it helps us also minimize long-term health impacts. So timely interventions can prevent long-term health consequences that may arise from untreated illness. For example, prompt management of acute respiratory infections like pneumonia can prevent chronic respiratory issues in future. Next, we have preventing disease spread. Some childhood illnesses, such as certain infectious diseases, can spread rapidly within communities. So early detection and isolation of cases help prevent further spread of this infection and protect other children in the community. Enhancing quality of life, we're saying that early treatment not only saves lives, but also improves the overall quality of life for children. It helps in reducing suffering, improving comfort, and enabling children to recover more quickly. We also have supporting families and caregivers, preventive health care overload, cost effectiveness, and promoting education and prevention as some of the importance of early detection and prompt management. Next, we have INCA components, and we have 6. We have recognition and management of sick children and infants. Identification of danger signs is number 2. Appropriate treatment and referral. Recognition and management of sick children. Identification of common illnesses such as the pneumonia, diarrhea, malaria. And lastly, treatment protocols and follow-up. What is the INCI approach? The approach uses the community level. We have the community healthcare workers being trained to disseminate information about common illness, health education and awareness for the community about the preventable diseases, healthcare level facility and preparedness in treatment of this complication, training the healthcare workers using the standardized guidelines and job aids that are provided by the Ministry of Health, and offering supportive supervision for the healthcare workers so as to improve the management. So what are the key interventions? We say we have early and exclusive breastfeeding. We do immunization according to the KP immunizations in Kenya here. We have adequate nutrition, so where we are saying exclusive breastfeeding for the first 6 months, right? Yes, children should get all the due immunizations. Appropriate nutrition, maintaining hand hygiene and sanitation so that to take care of these easily preventable diseases and preventing these other infectious diseases. So when we use INCI, we are going to reduce child mortality, we are going to improve child health and well-being, we are going to strengthen our health systems and community involvement, and we are going to use this cost effectiveness. Okay, it's cost effective and thus can be implemented. That being said, we also have some challenges, like we still have some limited access to healthcare in remote areas, lack of trained healthcare providers, so the resources are not enough for that. We also have social cultural factors influencing health seeking behavior. Children are still not being brought to the hospital because of poor seeking behaviors. We have to try and intervene in this. And then you have poor funding and resource constraints. Ladies and gentlemen, we have some success stories in countries that are doing so well, like Bangladesh. This one is often cited as the successful example of INCI implementation. In East Africa here, we have Rwanda and Tanzania. Okay, Rwanda has made significant progress in implementing the IMCI as part of its broader healthcare reforms. Tanzania has successfully implemented the IMCI as part of its effort to improve child health. In South America, we have Brazil. Okay, so Brazil has been successful in integrating IMCI in its primary healthcare system. In the Middle East, we have Pakistan. Pakistan has implemented the INCI in various provinces, targeting child health and well-being. India has integrated IMCI in its national health programs, focusing on reducing child mortality and improving child health indicators. And lastly, Nepal has embraced the INCI to reduce child mortality and enhance the child health. So, future perspectives, we can say that we need to scale up the INCA implementation globally. We need to integrate the INCI with other programs. Okay? And then research has to be done so that we can get more and more best practices. In summary, and this is my take, I can say that INCI is a transformative approach and saving lives and improving child health worldwide. So, through early detection, prompt management, community involvement, it empowers caregivers, strengthens the healthcare systems, and ensures a brighter future for our children. Let's continue our commitment to this IMCI in advancing global health, child health, and well-being. So together we can make a lasting impact and work on this and bring the best from this system. Remember, if we do so, we are going to reduce the mortalities witnessed in newborns and young children. Thank you so much and see you again.